Plan G and Plan N are the most popular Medigap plans, also known as Medicare Supplements, for people who want comprehensive Medigap coverage. The question is, which of these plans will be better for you, not just at age 65, but for years into the future? This video will give you all the information you need to decide between Plan G and Plan N. Medigap plans are insurance policies that fill in the gaps that would otherwise be your responsibility and out-of-pocket costs with original Medicare Parts A and B. Medicare Parts A and B are your primary health insurance coverage. If you have a covered medical expense, Medicare pays first, then your Medicare Supplement will pay based on the plan benefits. There are no networks with standard Medicare supplements. You are free to use any doctor or any facility that accepts Medicare. You also don't have to worry about benefit changes. Medigap benefits are standardized by law. Your Medigap insurance company cannot change your benefits. Let's take a closer look at the differences between Plan G and Plan N. As you can see, the inpatient coverage is identical whether you have a Plan G or a Plan N. With either N or G, if you have a covered inpatient stay, all costs will be paid by Medicare Part A and your Medicare Supplement. The only differences between N and G are in the outpatient coverage. Let's take a look at those. Medicare Part B excess charges are covered by Plan G, but not Plan N. One important note, Medicare excess charges are only allowed on Part B, which is outpatient coverage. It's not possible to have an excess charge on anything that is inpatient, whether hospital or skilled nursing facility, which would both fall under Medicare Part A. Whenever anyone talks about excess charges, just keep in mind those are only possible for outpatient treatment. The only way you can be billed for a Medicare Part B excess charge is if you see a non-participating Medicare provider. A non-participating provider accepts Medicare patients but does not accept Medicare payment as payment in full and can balance bill patients up to 15% as an excess charge. Medicare incentivizes medical providers to be participating providers by paying non-participating providers less. Only about 2% of Medicare doctors contract as non-participating providers. And of that 2%, over 40% of those are in the mental health field. Unless you are receiving outpatient mental health treatment, it is highly unlikely that you will ever see a Medicare Part B excess charge. However, if you want to be absolutely sure, you can always check your doctor's contracting status using the Physician Compare tool at Medicare.gov. Years ago, excess charges were a much bigger risk than they are now. Facilities like Mayo Clinic used to be non-participating providers, so for anyone who wanted to use those facilities, it made sense to purchase a Medigap policy that covered excess charges. Now though, even Mayo Clinic at all of its locations is a participating provider and no longer charges excess charges. Also, 8 states have outlawed Medicare Part B excess charges. Those states are Connecticut, Vermont, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, and Rhode Island. If you receive medical treatment in those states, you cannot be charged a Medicare Part B excess charge. And thanks to new legislation, ambulance companies, whether air or ground, can no longer charge excess charges for emergency transportation. There can still be billing issues with Medicare if ambulance transportation is not considered an emergency, which is something all Medicare beneficiaries need to be aware of. Since non-participating providers have to accept less money from Medicare in order to charge excess charges, most facilities and providers have decided it's in their financial best interest to contract as a participating provider, take the higher fee from Medicare, rather than trying to balance bill their patients with excess charges. Excess charges are very rare and they're not automatic even if you see a non-participating provider. The provider can decide whether or not to bill a patient on a case-by-case basis, and the excess charge might not always be 15%. The rule is the excess charge can be up to 15%, but it may be less. The other difference between G and N is that with Plan N, after meeting your Medicare Part B outpatient deductible for the year, You may have copays of up to $20 per office visit and up to $50 per emergency room visit. However, that emergency room copay is waived if you are admitted as an inpatient to the hospital. These office visit copays are not charged at every visit. It depends on how your visit is coded by your provider's office. So it isn't guaranteed that you will have a copay at an office visit, but if you do, that amount is capped at $20. In most parts of the country, Plan N has significantly lower premium costs than Plan G. As part of determining your overall cost for a Medicare supplement for the year, you should also factor in those potential Medicare supplement Plan N office visit copays. Here are some examples of actual price differences between Plan G and Plan N. I ran quotes for 70-year-old male and female Plan G and Plan N Medigap policies in the state of Florida. In both cases, the median monthly cost for a Plan G was about $50 more than a Plan N. In this example, unless a person is making more than 2 office visits per month or going to the emergency room every month, the person would financially be better off with a Plan N. Another thing that needs to be considered is rate increases. Medigap prices change generally once per year, whether you use your insurance or not. And most of the time, the price goes up, not down. These increases are based on the premium paid to the company versus the claims paid out by the company for everyone in your state who has that Medicare Supplement company's policies. Because it's based on the claims experience of the whole group, your personal health has virtually no effect on your price changes for a Medicare supplement. Different companies use different pricing models: attained age, issue age, or community rated. At the end of the day, the pricing method really doesn't make a difference long term to the individual consumer. This year, Plan G rate increases for most companies were around 5 to 7%, that is excluding any age increases. Plan N increases, for the most part, were between 2 and 5%. Of course, there are variations by zip code and company, but here's how those rate increases will look for a Medigap consumer after several years. Let's say someone enrolls in a Plan G at age 65 for $145 per month. If that policy has a 5% increase every year, it will be $185 a month at age 70 and $236 a month at age 75. If that person enrolls in a Plan N at age 65, the starting cost would be $105 per month. Assuming a 2% increase each year, that Plan N will be $116 per month at age 70 and $128 per month at age 75. Let's see what would happen if both Plan G and Plan N have rate increases of 7% every year. If our 65-year-old enrolls in a Plan G at age 65, that cost is $145 per month. At age 70, it's $203 per month. And at age 75, it's $285 per month. If the same person enrolls in a Plan N at age 65, they're starting at $105 per month. With the same 7% increases, that would be $147 a month at age 70 and $207 per month at age 75. At age 65, the difference in premium cost each month is about the cost of 2 office visit copays. By age 70, under either increase scenario, it's about 3 office visits per month. And at age 75, it's 4 or 5 office visits per month, not per year. Unless you have a condition that requires you to go to a doctor's office at least once per week at age 75, the Plan N remains the lower overall cost. Which plan is best for you? Your choice of Medicare supplement coverage is completely up to you. I can explain the benefits and the math, but each client chooses whichever plan they are most comfortable with. That said, for someone with a serious, chronic, expensive to treat condition that requires lots of office visits, Plan G is the clear choice. For healthy people who want comprehensive Medicare supplement coverage, it's really up to you. My goal is to make sure you have as much information as possible about what the future may hold when you are making this coverage decision at age 64 or 65. There is also the option of high deductible Plan G for people who are very healthy or those who have a substantial balance built up in a health savings account. For more information on High Deductible Plan G, please see the video linked above. Once you've decided on the Medicare supplement that has the right level of coverage for you, it's time to comparison shop all the companies that offer that plan in your area. Although the coverage is standardized by law, the cost for the same plan can be very different from company to company. It's important to do detailed research and comparison shopping before you apply. It can save you money initially and in future years. Fortunately, you don't have to do that alone. This is what we do for all of our clients. We work with many insurance companies and can impartially comparison shop all of them with you to find the plan and the company that best fits your situation. And we do this completely free of charge for our clients. We're able to do that because for every enrollment into a Medicare plan through our office, an insurance company pays us a commission. The commissions are very similar across all insurance companies, so we have no incentive to push people toward one company over another. We are free to find the plan and the company that fits each person's medical and financial situation the best. And the Medicare supplement cost to you is the same whether you purchase your plan through a broker or direct with an insurance company. Once you are a client, you have free ongoing access to help whenever you have a question or when rates or coverage changes and you need to do the comparison shopping again to possibly find different coverage. If you have Medicare supplement questions, please feel free to give the office a call at 877-312-1414 or reserve your free, no obligation Medicare plan consultation using the link in the description. We are here to help you understand your options and find the right Medicare coverage for you. Have a great day.